the American Health Care Act, as they're calling it. I mean, it's a start.
Right.
I'm not in love with the bill. There are changes I would like to make, and there are changes that I hope are made. I predict there will be changes made. I'm just relieved that they finally got something on the floor that we can start debating.
Right.
I mean, there's been all this. I was sworn in January 3rd. I was ready to go the first week. And there's been a lot of debate and talk and dithering, and the American people didn't send us up there to debate and talk.
No.
So finally they put something on the table. It's not perfect. It's got some holes in it, but we're going to try to plug them. But I'll tell you what, it's a heck of a lot better than Obamacare, and I'll give you one example. What we've done by repealing Obamacare, and this will happen in the replacement too, we just cut taxes for the American people by $500 billion a year. Now, the media in Washington's lost sight of that. But that alone is going to save money in health care and put money in people's pockets.
I agree. And I have the same view as you do. This is a start. We're going to improve it as it goes along, but it's a heck of a lot better than what we've got now. I mean, it's not perfect, but at least we can work with this and make improvements to it. And that's what the American people want. I mean, they want action. They don't want, I mean, we could be debating and discussing this for months. But let's move forward.
What you've got to do is keep all this in context. Jeff, you know this, but we've got about 320 million people in America. About 292 million of them already have insurance. They have insurance provided by their employer. They're on Medicare or they're on Medicaid. Now, what Obamacare did was concentrate on the roughly 6%, 6 to 10% of the people who didn't have insurance from their employer, who didn't have Medicaid, didn't have Medicare. And in order to help those 6 to 10% of people, he turned the health care system and health insurance upside down for everybody else.
Right.
So all this raging debate in Washington, D.C. is really, it's about 6% of the people. Now, I'm not saying that's not a lot of people and they're not important. There are 11 million people. But none of this stuff is going to impact anybody else. If you have, in fact, if you have employer-provided insurance, and we do this right, your premiums and co-pays ought to go down over time, and at least they'll stop rising. Right now, what Obamacare did to help those 11 million people who buy on the exchange, as we say, it costs a boatload of money, and they don't get anything for it. They get health insurance that has huge co-pays and huge deductibles. And the plan that's been put on the table, which is a start, is going to try to reduce the cost for them and stop punishing everybody else.
Yeah.
It's also going to reform Medicaid.
Right.
Now, it doesn't go far enough reforming Medicaid, and I'm probably going to prepare some amendments in the Senate to go further. But it's a start.
Senator John Kennedy with us, Jeff Crouere here. Our talk line 504-556-9696. A lot of issues here we'll try to squeeze in with you, Senator. Your leader, Mitch McConnell, says that tax cuts are unlikely by August. A lot of people were disappointed when he said that, hoping that we were going to see quicker action. Do you agree? Is it going to take longer than many people were hoping?
Well, I don't agree, and I think what Senator McConnell's doing is trying to lower expectations. I can tell you what our goal is, because we've talked about it. Now, it's a pretty ambitious agenda, and I don't know if we will get it done. But our goal is to repeat. We've already voted. I've taken a first vote in the Senate to repeal Obamacare. We've got to take some more votes to do that. I won't bore you with the procedural details. But our goal by the middle to end of April has been to pass a replacement bill for Obamacare and to get Judge Gorsuch confirmed.
Yes.
We're going to start hearings on him next week. I sit on the Judiciary Committee where we'll be confirming him.
Good.
Then there's a break in April where people can go back home and talk to their constituents. And then when we come back, we would start on tax reform.
Mm-hmm.